Top of the morning to everyone. Dr. Z here, hoping everyone had a great St. Patty's Day for those who celebrate. Um, yeah, anyway, enough of that. We'll dive into today's topic, which kind of refers back to a few weeks ago. We were talking about orthodontics and when is the proper age to start seeing an orthodontist. And so, kind of a similar question that I get on the topic of orthodontics is, you know, I guess would basically boil down to why do I need orthodontics? Isn't orthodontics just for teenagers that are trying to get a nice straight smile? Isn't it just a cosmetic procedure? And so, goal of today's video is to kind of dispel that myth and talk about some other reasons why we would do orthodontics other than cosmetics. Certainly, in my mind, the first thing that I think of is creating a more functional spacing of our teeth. And what I mean by that is obviously having a nice straight set of teeth looks nice, but also for our ability to talk and chew and function, having a nice alignment of our teeth is also a good thing. That if our teeth are crooked, it can sometimes make chewing more difficult or can make it more likely to start breaking or grinding our teeth. That's a lot of times if our bites are not naturally even without some kind of correction, we're going to start grinding or breaking teeth until our jaw feels like it's in that normal position that it wants to be in. And so if we want to prevent broken or ground down teeth, orthodontics is one solution. Another reason for orthodontics other than cosmetics would be to correct, crooked and, overlapping and just really tight teeth that are crowded together. Because again, not only does this maybe not look as aesthetically pleasing, but also when our teeth are crowded, it makes it harder to brush and floss them properly, which in turn is going to make those teeth more vulnerable to developing cavities or periodontal disease or both. So yet another reason to get orthodontics. And a final reason that comes to mind would be airway. Another reason to do orthodontics is to open our airways. I've talked a bit in the past, and I plan to talk more in the future about the role that dentistry plays in airway maintenance and the epidemic that we're seeing of obstructive sleep apnea, where if our mouths are naturally too small and too crowded, it's going to limit our ability to breathe naturally through our noses, and we're going to do more mouth breathing, or if mouth breathing is not happening, then a lot of times that's where you get snoring and sleep apnea, where that airway is just collapsing. And so by expanding the arches of the mouth, making more room for air to pass through the airways, that accomplishing that with orthodontics is going to relieve some of those symptoms of poor airway maintenance and sleep apnea. And so those would be the main reasons, aside from cosmetics, that your dentist might talk to you about getting orthodontics. Even if you're happy with the appearance of your smile, if you're constantly finding that you're always breaking teeth or grinding your teeth down or that you have sleep apnea, all of these things, can't guarantee, but in most cases, orthodontics by correcting the alignment of the teeth will help resolve these issues. And so certainly keep an open mind. If you're battling some of these things and your dentist recommends an orthodontist, it doesn't mean that they think you have a ugly smile by any means, but they might be talking to you about, okay, here's another way that instead of constantly fixing broken teeth, that we can get ahead of things and correct things before more teeth start breaking. So hope that makes sense. And like I said, some of this stuff I want to talk about more in future episodes, but for now, I want to thank you for the privilege of your time, and I will hope that you will join me on future episodes of Tooth Teacher Tuesday. Until then, have a great week, everyone.